President Cyril Ramaphosa says legal challenges faced by government against the lockdown are part of our constitutional democracy. Today, the Democratic Alliance said it would be heading to court to challenge aspects of the Disaster Management Act.
The lockdown has disrupted people's lives, and as a result, there are quite a number of people, organizations, who do feel aggrieved. And we did say right from the beginning that all of us will be required to make some sacrifices as we deal with this health challenge, which has also turned out to be an economic challenge. Our constitution is a very robust constitution. It allows anybody, and our legal system, it allows anybody who is aggrieved to have the right to approach the courts. And a number of people have done so. They've exercised their rights to approach the courts, to put their cases before the courts, and some have succeeded and some have not succeeded. It is a right that every South African has, and even I as president could never stand in the way of anybody who wants to challenge, indeed, not only what we've put in place, but also any decision that we take. So it's a free country and anyone can challenge what we do.
All right, so the president was speaking there earlier in the Eastern Cape, but before those sentiments, he was assessing the Eastern Cape's readiness for the inevitable increase in COVID-19 cases. The province now has 1,534 cases, 24 deaths, and has had 632 recoveries. Let's chat now to SABC reporter Lerato Fekisi, who was on that trail with the president and the health minister, amongst others. Lerato, very good evening to you. It's been quite a long day for you, but let's start here. There's been some criticism over the handling of the COVID-19 in the Eastern Cape. Did you get a sense, perhaps, by the president's visit today, together with his entourage, that he was satisfied with the feedback that the provincial government had given him pertaining to the handling of the coronavirus there?
Good evening, Crisalda. I think there is no doubt that the President and the Minister of Health are both very pleased, satisfied, and also content with the work that has been done by the provincial government to stop the spread of the virus. Like you said earlier on, when the Minister visited the province a few weeks ago, he expressed dissatisfaction, but they've turned things around, putting all hands on deck to make sure that they stop the spread of this virus in this province. When I speak about putting hands on deck, I speak about infrastructure development at various hospitals, ensuring that PPEs are going out to the people, the health workers on the forefront in fighting this virus, and also making sure that our schools are ready. The Premier Oscar Mabuyane lamented that they've already got over 1,000 schools they've prepared to host grade 7s and grade 12. So holistically, local government has put all hands on deck, both the Department of Health, Education, and also municipalities and the government doing all they can to come together to fight this virus.
Lerato, staff shortages were a major issue for the Eastern Cape. I understand that more nurses will be employed. Tell us more.
Yes, the MEC of Health, Sindiswa Gomba, said today that they have actually employed over 1,000 nurses and also more doctors, and these will be deployed throughout the Eastern Cape, especially where there are shortages. And also, we have also heard that 20 Cuban doctors will be coming to the metro. You understand that this specific metro is the epicenter, Crisalda, with over 500 infections. So Cuban doctors will be coming here and also to the Buffalo City.
Was there any talk of the allocation in terms of funds for one of the other critical areas, which is the development of hospitals? The old infrastructure is one of the challenges that is quite widely known.
The Department of Public Works made an announcement that they're going to and are allocating 50 million rand for the infrastructure development of hospitals in Mthatha, East London and Port Elizabeth. And 5 million of that, Crisalda, will come to this metro because, as I said, we are the epicenter. And all of these hospitals are being developed or being fixed because they want to identify them and use them to house COVID-19 patients. So that money is going to be allocated to make sure that as the numbers increase and perhaps also as the stats increase in this province, the hospitals are in right standing, in good condition to take these COVID-19 patients.
Lerato Fekisi, SABC reporter in Port Elizabeth. It's been a long day for you and our colleagues there. Thank you very much indeed for your time. We'll unpack a bit more about what happened in the Eastern Cape very shortly, but let's start here.